What are the clinical features? As I told in last class itself, you should have learned about the general features of anemia. Tired, lethargy, lassitude, unable to concentrate, all these things. Whereas certain hemolytic anemia, they have certain features. They are usually anemia of mild degree. That means hemoglobin will not be very severe. There can be there usually hemoglobin reduced. It will be reduced than normal, but it is not very reduced. You cannot find hemolytic anemia in 3-4 gram per deciliter. It should be around either 9-10 kind of anemia. Skin is lemon yellow because of jaundice. Sclera, that is tinge because in upper bulbar conjunctiva you see about icterus. Then dark stools because of the bilirubin is excreted through the stools. Normal urine, their exposure to dark air, exposure to air, they will become dark in color because of this condition, hemolytic anemia. Then hepatosplenomegaly, they are seen in chronic hemolysis, and they are not seen in sickle cell anemia, which is an important condition to be discussed in case of hemolytic anemia, where there will be something called as autosplenectomy. MCQ. Autosplenectomy is associated with which of the condition? It is sickle cell anemia. Then biliary obstruction and gallstone formation is seen in hemolytic anemia. They can be pigment stones because of extrahepatic obstructions and viscid bile because of intrahepatic obstructions. Okay, MCQ questions. Then chronic hemolytic anemia can lead to leg ulcers, occurs usually over the malleolus. Then there are certain crises. As I told, hemolytic anemia is one anemia where there is the anemia of mild degree. Whereas certain conditions can aggravate the anemia and become into very severe forms, we called as crisis. There can be hemolytic crisis. That is, they are associated with fevers and rigors, chills and all this thing. What happens? Pyrogen. Pyrogen means, pyro means temperature, fever causing agents. Okay. When the pyrogen released from these RBCs, they get what happens? They go and cause generalized bone pain, body pain, acute abdominal pain, backache, and there may be vomiting too. And there is aggravation of anemia, deepening of jaundice and discoloration, because normally hemoglobin is maintained at 9 to 10 and all. But due to this hemolytic crisis, more and more hemoglobin is ruptured, RBCs are ruptured, more and more hemoglobin is released into circulation, will lead to exacerbation of anemia, exacerbation of fever, rigor, chills, and all these things will be associated with these things. Okay, hemolytic crisis. Then aplastic crisis. Aplastic crisis, there is inability of bone marrow to replace the destructor RBCs. As I told, in hemolytic anemias, the factory is working normal, whereas the factory products are being destroyed in the periphery. So factory will try to compensate by increasing the productions. That's how NRBCs, polychromatophils, all these things are seen. But in case of aplastic crisis, where because of this viral parvovirus B19 and hepatitis B to some extent hepatitis B and hepatitis B virus infection will lead to complete failure of these factory machines. There will be bone marrow erythroid hypoplasia. All the case of hemolytic anemia will have bone marrow hyperplasia, where in case of aplastic crisis, because of parvovirus B19 and hepatitis B virus, it will lead to bone marrow erythroid hypoplasia. Since bone marrow factory is failed, reticulocyte will be reduced. Reticulocyte is the indicator that bone marrow is working. So bone marrow is working, erythroid hyperplasia will be there, reticulocytes will be there. In cases of aplastic crisis, because of parvovirus B19 and hepatitis B virus, there can be failure of bone marrow and reticulocytes will be absent and reduced. Okay, and severe anemia can be there, and without jaundice it can happen. Something called as sequestration crisis, that is trapping and pooling of RBCs in the spleen and liver. Okay, what happens? RBCs are supposed to negotiate into the capillaries and go away, give off oxygen, take carbon dioxide and circulate and all these things. What happens? The abnormal shape, lysis, all these things. RBCs are intact, round ones. If it is get damaged, like it will not damage in a clean cut, like how glass will cut. No, it will have various shapes, sparks, sharp areas and all these things will be there. So all these things will go and damage the blood vessel. They get sticky, they get obstructed, all these things. Once they get trapped, eventually the backflow pressure will be increased. So they are more trapped and all these things eventually lead to something called a sequestration crisis. It can happen in spleen and in liver too. Something called as megaloblastic crisis. Anemia, this is a severe anemia without jaundice in case of hemolytic disease, where there is reduced reticulocyte count and there will be some macrocytic features and bone marrow showing megaloblastic anemia because of associated with something called as folic acid deficiency is happening coexisting with the hemolytic anemia. Then something called as vaso-occlusive crisis. As I told, where blood vessels are getting stopped, circulation is stopped, blood pressure, backflow is happening. This is called as vaso-occlusive crisis, also called as thrombotic phenomenon. It is a very painful condition. Sickle cell anemia usually presents as priapism. Priapism means painful erections of penis.